in the country. Of course, poisoning is a significant public health concern in Uganda, with estimates suggesting over 11.4 deaths per thousand. 11.4 deaths per 100,000 people die annually as a result of poisoning. So this issue disproportionately affects rural areas where where poor health care delivery and lack of emergency services exacerbate mortality and disability rates. So the Directorate of Government Analytical Lab, which is based in Wandegea, plays a crucial role in addressing this issue through its toxicology division, which conducts medical legal investigations and provides advice on the diagnosis and management of poisoning. So what are the common causes of poisoning and the fatality rates in Uganda? We have the first common cause is agrochemicals. These chemicals they use on plants. They account for 42.4% case fatality rate. 42.4% of people who are poisoned use agrochemicals. There's this booster, there are some of these fertilizers and other chemicals that are used in agriculture. Some of them are poisoned, others are self-poisoned. They drink it themselves. Then two, we have household chemicals. What are the household chemicals? We have cleaning materials like jig, cleaning materials like all of those the chemicals that we use in our houses. They account for 22.1% case fatality rate. Then we have carbon monoxide. There's a type of gas called carbon monoxide. This one is as a result of suffocation. When there are fires, especially, what accumulates is carbon monoxide and people suffocate to death. They account for 20%. Then snake bites, 14.1%. Food poisoning, 1.4%. When we talk about food poisoning, we categorize them into two. One, there is where people administer poison in the victim's food, whereby people eat and die. Then we have food poisoning, which comes as a result of eating food that is infested with bacteria. So those are the two types of food poisoning. So under poisoning caused by pesticides, 64.5% of the poisoning cases are due to deliberate self-poisoning. Some people, as a result of problem A or B, take poison. And with children younger than 12 years, teenagers, and young adults over 30 years, accounting for a big percentage. So 64.5 of these take agricultural chemicals because they deliberately want to die. So in urban areas, we have pesticide poisoning that has been reported to cause about 28.8% of the deaths of those. What are the high-risk groups? Children under 12 years, we have teenagers, we have young adults who are over 30 years, also killing themselves. What contributes, what causes this poisoning? Lack of information on chemical and poison handling. Some people poison themselves unknowingly by handling chemicals in a way that is not safe for them. Insufficient evidence on poisoning extent and types is another cause. Poor collaboration among institutions handling chemicals. They don't give a lot of information about chemicals, so the handling is not done appropriately or professionally, leading to death. Limited knowledge on poison types and exposure. There's limited knowledge on poison types and exposure. People don't know which type of poison this is and how fatal or serious it is. Then inadequate protective measures and cleaning practices. There are people who use chemicals at home. Some of these chemicals are very dangerous, but they use them in a laissez-faire way. Chemicals like jik, for instance, is very fatal. Even chemicals like paraffin in homes is dangerous. Some homes keep petrol in jerry cans. That's a chemical that can be ingested by children unknowingly and may cause death. Then the region is most affected. Which region tops poisoning? Which region of all this? We have Eastern region tops in poisoning. With number 1 district, Palisa, followed by Budaka, followed by Chibuku, and those districts are neighboring each other. Then followed by Mbale, Serere, and Kumi districts. There's a lot of deaths as a result of poisoning in these districts. There's a high rate. Then followed by northern region. Northern region we have Gulu, we have Nwoya, we have places like Kole. These are also, it's common. Then western region follows with the Isingiro district topping the list. Isingiro from western Uganda. People who die of poisoning mostly come from the district of Isingiro. And then central Uganda here is not so much, but mainly from the greater Masaka region. That's where most poisoning takes place. Kampala is the least in the whole country. Then suicide was reported to cause 63.3% suicide, where people take poison on their own, at their own interest. People go and hang themselves. So suicide here was reported to have caused 63.3% as of last year. And most of these, that is in urban area, as compared to 25.6% in rural areas. And the common causes here, of course, stress. There has been cases of stress, people killing themselves because of stress, because of extramarital affair, because of those things of cheating on partners and stuff like that. People have been killing themselves. Then medicines for people and animals, supplements and remedies, which include, there has been reported very high death rate as a result of misuse of paracetamol. Paracetamol, which we call Panadol, ibuprofen, these are painkillers, iron tablets, contraceptive pills for ladies, antidepressants for pressure, cough and cold medicines, and vaporizer fluids. There has been a likelihood that there are people who have headache, especially a very strong headache, believing that for them to cool down that headache, they have to take a lot of paracetamol. So as a result, they end up dying. Personal hygiene products and cosmetics, which include hand sanitizers, mouthwash, shampoo, perfume, and nail polish remover, very dangerous. There was a case of some children who drank sanitizer, I think in this place called Chisu. Where children died as a result of drinking hand sanitizer, just found at home. And then, of course, we have ladies also who have got problems just by misuse or abuse of nail polish remover, which is also dangerous, and perfumes which are sprayed accidentally in the nostril. Some people go overboard. They want to spray perfume even in their noses to smell good. So this is very, very dangerous to especially our friends, the ladies, who use perfume so much. Then cleaning products, which include dishwashing chemicals, laundry liquid, dishwasher powders, and tablets, bleaching chemicals, oven cleaner chemicals, eucalyptus oil, and shower cleaners. These are very dangerous chemicals. Paints and solvents, which include methylated spirits and turpentine. This paint is also dangerous. Of course, it is good to look at a very well-painted room like this one, but it's dangerous for you to inhale that fresh paint smell. It's not good for your health. Then we have also pesticides, which are used in gardens, such as flea killers, fly sprays, animal deworming tablets, insecticides, herbicides, mothballs, rodent and cockroach baits. You should be able to handle them very well. These days, cockroaches are so many in cars, and including rats. So, but for you to be able to kill them, administer the bait when you are not in the car. First, keep the car at a distance and lock it. Put the bait there for some time. Then make sure the rodents or the cockroaches are dead, and then open the doors, all of them, and let the car remain open for a period of, as scientists advise, 2 days. Then that chemical goes out. Then garden and auto products, which include fertilizers, petrol, talked about petrol, diesel, oil, and radiator fluids. These are dangerous. Poisoning plants, insects, and reptiles. There are plants which are poisonous. There are also reptiles like snakes. Of course, and also insects. When they bite you, they inject into you some poisonous substances. And then the toys and other items, which include batteries, glow sticks, bubble blowing solution, which are used by children. Sometimes even food has become like a poison. Recently, I had a kid dying as a result of, I think, pushing a pin into the nose, which went and blocked the lungs. So please, let's be very careful with that. So chemical signs and symptoms of poisonings. How do you know you have been poisoned accidentally? And what do you do after discovering that you have been poisoned before you go to the health clinic or to the health service center? How do you help yourself? If you suspect that you have been poisoned, these are the signs and symptoms. I am not a doctor, but these are coming from our scientists from the analytical lab. I am communicating to you as a layman. I am not a medicine person, but I am giving you information coming from the experts. Malaise, the sign of malaria, shivering, excessive salivation. If you see somebody with a lot of saliva, you have just finished eating food, but you feel a lot of saliva in your mouth, be suspicious. Lacrimation, urinary incontinence. You are feeling you want to go and pass out to urine, it cannot come out. That is a trigger. Vomiting. You have just had a meal, a very nice meal, then you start vomiting. All of a sudden, there must be something. Pinpoint pupils, meiosis with blood vision. You have finished eating food or something, taking it, then you lose your sight. Quickly notice that there's something there. Headache, uncontrolled headaches, nausea, having that feeling of wanting to vomit out what is inside you, abdominal pains, excessive abdominal pain. Diarrhea, you start diureting uncontrollably. Incoordination, you cannot be coordinated. You want to move, you can't balance yourself. You want to walk, you can't. Muscle weakness and muscle fasciculations. Muscles become weak, you can't support your body, you cannot stand, you want to fall down. Then you become dizzy, and you then start sweating uncontrollably. These are some of the triggers. Of course, slurred speech. You can't talk properly. Now, if you see somebody with these signs and symptoms, it is very likely that somebody has been poisoned. Now, how do you prevent? First of all, if you suspect you have been poisoned, what do you do? If you suspect poisoning, please call this number. This number is going to be picked by experts. We are supposed to provide a toll-free number, but we have not yet developed one. No, we developed one, but it still has issues. Now, we have this number. At any time of the day, you can call this number. If you suspect you have signs and symptoms of poisoning, you will be helped by the experts. Call this number. Very important. 0752 438 587. Immediately, you will be assisted. The person holding this phone does not go to sleep. Yes. Works with the Directorate of Government Analytical Lab, is paid by government of Uganda to prevent poisoning. That is his work. So he will advise you immediately. You have a relative, you have a loved one who has swallowed some poison, maybe accidentally, and you know it is poison, it has entered. Call this number, you'll be advised on what to do immediately. And this is how you should prevent poisoning in a home. Keep medicines and poisons out of reach of children. They have written this on most of these bottles, but people don't read, you know. Ugandans have a habit, we have a habit of not reading. So put them in a locked cupboard or container, put them in a high place, at least 1.5 meters high, where children cannot access. I've told you of children who drank sanitizer somewhere in Kasubi, and before they realized, the kids were vomiting, sweating, panting, and by the time they realized that this kid had taken sanitizer, it was too late, and the kids passed on. Never leave medicines or poisons unattended to. Don't leave, even this Panadol, I have just talked about paracetamol. It's a Panadol, don't just leave it on the table. Children will want to adventure. They want to explore what is inside there. Then they always test and swallow. Always supervise children around medicines and poisons. They are fast. Children are very fast. They are curious and are great at climbing and finding ways to open cupboards and containers. They open and see what is inside. Just the other day, there was a kid in my village, Bududa, who was killed as a result of removing by electricity. He was electrocuted. He wanted to know, how does electricity make a radio play? So by pulling out, when he pulled out the cable, the radio stopped. When he put it back, the radio came on. So he removed and also put in his mouth and see what could happen. And that was the end. Just recently. We have just actually attended burial recently. So never leave children unattended to. Never leave food unattended to while cooking from outside the house or kitchen for communities cooking. Don't leave it unattended to. This is where criminals will poison the food. There was a family somewhere in eastern Uganda that was poisoned. They were preparing, I think, a meal of porridge outside, and all of them were inside watching TV. This criminal walked around and put poison in the porridge, and the whole of that family was wiped out. They did not know, they didn't have any information, they were ignorant. All they knew, the children started vomiting, diarrheaing, and they started giving malaria tablets. Meanwhile, the poison was taking a toll on them, and the whole family of 8 people was wiped. So please, keep medicines and poisons in their original containers. It's poison and puts in a mineral water bottle. When a child sees, and most of these medicines and poisons are colorless, they will come and drink as if they're drinking water, because it is not in the original container. Always read the label and follow all instructions, directions, warnings, and safety precautions. So these are the poison cases that our directorate received. We received 967 cases of poisoning between January and September 2024. 967 poison cases. So we also analyzed 3,868 samples. These are samples we analyzed from various places, but the ones we received were 967. But all in total, the samples were analyzed from various groups of people, of institutions, totaled to 3,867 for the year ending 2023. So in total, we have handled over 5,000 cases of poisoning. So you can see it is a very great number, and I mentioned the biggest victims, the biggest numbers of victims dying as a result of poisoning are coming from Palisa district in eastern Uganda. So please take note of this. That is what I have for you this morning.